Lung cancer is a significant health issue that emerged as a more prevalent disease in Britain after 1900, coinciding with changes in societal habits, medical advancements, and government interventions. Before the 20th century, lung cancer was relatively rare, primarily because one of its major causes, cigarette smoking, had not yet become widespread. The mass production of cigarettes in the late 19th and early 20th centuries, along with aggressive marketing campaigns, led to a dramatic increase in smoking, particularly during and after World War I. This rise in smoking habits resulted in a corresponding increase in lung cancer cases, as the harmful effects of tobacco smoke on the lungs became more apparent over time. The link between smoking and lung cancer is well established through scientific research. Tobacco smoke contains carcinogens, substances that cause cancer, such as tar, nicotine, and benzene. When inhaled, these substances damage the cells in the lungs. Repeated exposure to these carcinogens leads to mutations in the DNA of lung cells, disrupting normal cell growth and function. Over time, these mutations can cause cells to grow uncontrollably, forming tumors that characterize lung cancer. The relationship between smoking and lung cancer was not fully understood until the mid-20th century, with significant studies in the 1950s, such as those by Richard Dole and Austin Bradford Hill, which provided strong evidence of the connection. As lung cancer became more common, the medical community faced the challenge of diagnosing and treating the disease. Early diagnosis is crucial in lung cancer, as the disease is often asymptomatic in its initial stages, and once symptoms appear, the cancer is usually advanced. Over the 20th century, there were significant improvements in lung cancer diagnostics and treatments. Initially, diagnosis relied on basic imaging techniques like X-rays, but these were often insufficient for early detection. Advances in medical imaging, such as the development of CT, computed tomography, scans and PET, positron emission tomography, scans, have greatly enhanced the ability to detect lung cancer at earlier, more treatable stages. Biopsies and molecular testing have also allowed for more precise identification of cancer types and the genetic mutations driving them, leading to more targeted treatments. Treatment for lung cancer has also evolved significantly. In the early 1900s, surgery was the primary option, but it was risky and often ineffective for advanced cases. The development of radiation therapy provided a new treatment avenue, and later, the introduction of chemotherapy offered a way to target cancer cells throughout the body. In recent decades, the advent of targeted therapies and immunotherapy has revolutionized lung cancer treatment. These new treatments focus on specific genetic mutations within the cancer cells or harness the body's immune system to fight the cancer, leading to improved outcomes and increased survival rates. Recognizing the strong link between smoking and lung cancer, governments in Britain and other countries have launched extensive public health campaigns to reduce smoking rates. In the mid-20th century, as the evidence linking smoking to lung cancer became undeniable, public health authorities began to take action. Early efforts focused on educating the public about the dangers of smoking, often through media campaigns and warning labels on cigarette packs. Over time, these efforts became more comprehensive, including the banning of cigarette advertising on television and in other media, implementing smoke-free laws in public spaces, and increasing taxes on tobacco products to make them less affordable. These measures have been effective in reducing smoking rates, particularly among younger people, thereby decreasing the incidence of lung cancer. In conclusion, lung cancer's rise in prevalence after 1900 is closely linked to the widespread adoption of smoking, a behavior driven by social, cultural, and economic factors. The medical field has made significant strides in understanding, diagnosing, and treating lung cancer, transforming it from a mostly untreatable disease to one where early detection and advanced therapies offer hope. Simultaneously, government campaigns aimed at reducing smoking have played a crucial role in preventing lung cancer, demonstrating the impact of public health initiatives on a major health crisis.